Hi, I'm Dr. Angela Yeagley of Sage Health TV, a show where we give you tips on optimizing your health and wellness. Today I would like to talk about medical imaging, that really it's designed, we think to help us, but is it really actually hurting you in some way? So when we look at, some of the common ones that we might receive, like for women, mammograms, dental x-rays for everyone, as well as like if you need an MRI, if you've had an injury, you might go and have an MRI with contrast, which is called gadolinium. So all of these have an element, of course we need that information. Certainly these are tests that we order here at Sage, but we know that there is toxicity associated with these particular tests that you would receive. So first let's talk about any sort of radiation. So that's x-rays, CT scan. So first thing I like to mention that most people don't think about, if you're having dental x-rays or again, chest x-ray, chest CT, mammograms, your thyroid is actually exposed. And there's some thought now that over time, as we receive these different types of radiation, without protecting the thyroid, that it can be affected. So one thing you can do in this area, dentists are usually pretty good about this. You lift those flaps up, right? Protect your thyroid, it's right here. And then actually when receiving a mammogram, you can request a thyroid shield. They don't normally offer it to you. So it is something that you have to go and ask the technician for. And then it's something that it is going to be lead lined. It's a little heavy, but you can put it around here and it will protect your thyroid because the amount of radiation in a mammogram is larger than what you're going to get in a dental x-ray. So this is more significant you really want to do this, especially over the long term of your life, right? And then getting in, again, these are necessary tests. How do we better protect ourselves? So related again to the radiation-based testing, I'm a big fan of antioxidants before you go in, and then definitely antioxidants after you leave and have your test done. So what are antioxidants? Most people know they're agents that are nutrients that we bring in, and that can be through food, that protect our cells. So we think of like food-wise, you're thinking of dark leafy greens, dark berries, again, all I would recommend organic, and other things that are high-dose vitamin C, so thinking of color, right? Lots of color, but usually to kind of counter the amount of radiation damage that occurs, we want to go high dose. So I'm a big fan also of like higher dose vitamin C, what we call like up to bowel tolerance, until it makes you poop, basically, and doing that before you go in and definitely after. And then for people who are super hardcore, and this is what I do it IV. So IV, you can actually get nutrients in at a higher dose of that vitamin C. So before you have it done, have an IV, high dose vitamin C IV. After I have it done, high dose vitamin C. Again, just to give that extra protection to my cells. In addition to, a lot of times I'll add other antioxidants like glutathione, alpha lipoic acid, vitamin E. And then one that I haven't mentioned yet is having an MRI. So you're actually receiving a contrast agent called gadolinium, and that, what I've seen is so fascinating, is that will stay in people's systems for years. So I might do, a test for it in people's urine or blood years after they've actually had that imaging, and it's still in there, and it is considered a toxic metal. So, there are ways, again, we go into more chelation. Antioxidants still make sense, but then you want to give things that actually will bind metals and pull it out. And so naturally that can be like organic chlorella, organic spirulina, are great choices. And again, they have to be organic, because if they're growing in a non-organic source, they actually pick up metals from the environment, and then you take that. So you don't want that. Organic only. And then getting into like organic cilantro is fantastic. And citrus pectin, also amazing. And even a little bit of bentonite clay away from everything else is a binder, really good binder. And then, for some people who have very high levels, then we start looking looking at like IV specific chelation, which is kind of a heavy hitter. And usually that's their cases if somebody is just feeling like, you know, they have something significant they're working on in their health. So, so if you have questions about this, you know, if you've had these procedures and you're just wondering, you know, how better you can support your body, or looking at a regimen of protection around getting your imaging done, you know, maybe your yearly mammogram, we're here for you. You know, our goal at Sage is to help you, you know, move in and guide you into kind of your best, you know, health possible. So please, if you enjoyed this episode, please like, follow, and subscribe. And we look forward to seeing you at the next episode.